New Mexico, I see George Kapalka. So George, you're up. And I'm so excited that you're here with us. And I'm so excited with what you're doing at Alliant. And you were just elected president-elect of the State Psychological Association New Mexico, which is the Prescribing Psychologist Association New Mexico. So take it away, George.
I'll be brief, just a short update on what we've been up to in New Mexico. We continue to be very proud and encouraged by our law. Most of you, of course, are familiar with our journey here in New Mexico. We actually celebrated our 20th anniversary this year of the law passing in New Mexico. Actually, the law passed in 2002, but then it took about 2 years for the first prescribing psychologist to actually be able to practice, which happened in 2004. So since like in all RXP states, in the early version of the law, there were a number of restrictions that gradually we had worked to be able to improve over the years, and we had a major expansion of our law late in 2023, and I am happy to report that the Board of Psychologist Examiners just passed the updated rules. So a couple of the changes is now we are practicing prescriptive authority in accordance with the standards of the field of clinical psychopharmacology. We feel that this is a major improvement because you no longer have to specifically list the formulary that we have to use as prescribing psychologists. So this is a major expansion that allows us to continue to write prescriptions in accordance with the standards of the field. An important addition also has to do with the fact that now the law, albeit in consultation with the patient's physician, which most of the time would be primary care professional, but nevertheless, upon consultation within 20 days, we are now able to write prescriptions for medications that would treat the side effects associated with some of the medications that we may prescribe. Now, this is significant because with some patients on antipsychotics, for example, they may develop, type 2 diabetes. We can now prescribe metformin for that, as an example. We all know that, for example, with lithium, lithium has a lot of effects on the thyroid, right? If the thyroid becomes suppressed, now we can prescribe thyroid medication as part of the comprehensive approach. So this is another major expansion of what we can do as prescribing psychologists. And finally, another significant step forward is, New Mexico has structure which is very similar in some other RxP states too. We have the 2 practicums that have to be completed before you become a prescriber, the 80-hour and the 400-hour 100 patient. And then we have a 2-year conditional period during which you also have to be supervised. And so far, that supervision had to occur by a medical professional, but now prescribing psychologists with at least 5 years of experience have been added to the list of individuals, of the supervisors who can prescribe who can supervise new prescribing psychologists within the conditional period. So we're very excited about this, and if some of you are interested in coming to New Mexico, we currently have just under 70 prescribers. It's a big state with a lot of need, and we're here, so if you're thinking about it, we would welcome you. Thank you.
Thank you, George, so much. So much has happened recently, and it's exciting to hear the progress because it, as Mark was just saying, it's an evolution. And as I've been talking about, it starts at a certain point, and then we keep on growing. So thank you for proving that point in New Mexico.